Welcome, I'm Bruce Munro, and with me is International Relations Specialist via video link, Professor Robert Patman, and this is Global Insight. COVID-19 is disrupting life at many levels, including in the political sphere, where the rise of populism has been a noticeable global trend in recent years. Welcome, Robert.
Good morning, Bruce.
Could COVID-19 reverse the populist upsurge?
Well, first of all, I think we should be very clear on what we mean by the populist upsurge. A number of politicians have made it into power in countries like the United Kingdom, the United States, and Brazil, and presenting themselves as populists. What is a populist? They present themselves as authentic voices of the nation. They also present the troubles of the nation as being the result of foreigners or immigrants. They also believe that nation states run the world and that many of the problems of states can be attributed to, if you like, global elites. And so this is their prescription. They're pretty strong on promises, and many of people like Boris Johnson, Donald Trump, Jair Bolsonaro in Brazil have got to power essentially on a mixture of exploiting a mixture of grievances, hate, resentment, and making quite outlandish promises. So that's the upsurge of populism that we've seen. What's been revealing about the COVID-19 crisis since it developed, it should be recalled that it was in the Wuhan in China when the first cases were detected, and they were confirmed by the Chinese government about a month later in December. So since early January, I think the world's been on alert that we're facing a very serious health problem. And if you look at the three cases in question, the United Kingdom, where there's a populist government, the United States and Brazil, they have struggled to come to terms with this problem. It's quite, at first they downplayed the problem. The WHO was warning by the end of January that there was an international global health emergency, and by 11th of March they said it was a global pandemic. But there was plenty of warning. From January onwards, the World Health Organization in mid-January was suggesting this was a really serious problem and was advising it was advising people to take basic health procedures, and it was urging governments to put an emphasis on testing, isolation and quarantine. But in Britain and the United States, they were very slow to respond. Britain initially responded in February with what some people have called the herd immunity approach, was an attempt not to suppress it, but to contain it. Now, the government in the UK has subsequently abandoned that problem. Meanwhile, in the United States, Mr. Trump spent much of February downplaying the issue. He even predicted it would be gone by April. And he's urged Americans to face the prospect of getting back to work as soon as possible, probably by the end of Easter. So there has been, if you like, a lot of denial going on in both the UK and the United States. And Brazil, it's a similar picture. Bolsonaro, even 2 days ago, was suggesting that it was a Chinese conspiracy that was leading to COVID-19. So it seems to be a bit of a pattern here. We've got, unfortunately, and no one should derive pleasure from that, all three countries have been severely hit by COVID-19. And if you look at the United Kingdom, the death toll is now more than 7,000 in the United States and rising steeply. It's more than 14,000 and rising steeply. In Brazil, which was affected by COVID-19 a little bit later in the picture, the death toll is currently just over 600 and rising. Was this inevitable? No, it wasn't. It was because these populist governments were very reluctant to listen to science and public health professionals. And as a result, they've had to react somewhat late, somewhat belatedly to a global pandemic. And unfortunately, they are now scrambling. At one point, to give you an idea about the scale of this, Bruce, at one point, Mr. Trump turned down the offer of ventilators from the WTO because essentially they weren't American made. And Mr. Johnson turned down the prospect of a European-wide effort to distribute ventilators. So on the grounds that Britain was now an independent country. But both countries are facing very serious problems. This could mean, I think, as public reflects how these governments perform when dealing with an actual crisis. You see, most of these politicians seem to be very capable of dealing with crises that they create or believe that have been created in the past and diagnosing them. But the first big test, a problem like COVID-19, really seems to have found them wanting. Why is that? It may be because COVID-19 knows no borders. It does not, it's indifferent to what populists call it. And also the most reliable way to deal with the problem involves scientific expertise and health professionals. And I think what we've seen in the last 3 months through COVID-19 is that the world will increasingly have to cooperate. And this, of course, cuts right across the populist message that states can go it alone to solve their problems. COVID-19 seems to suggest the opposite. And it's no coincidence that Gordon Brown, a former UK Prime Minister, is now recommending a temporary form of world government to tackle the twin crises, the economic crisis and the medical crisis caused by COVID-19.
Thank you, Robert. Can you just quickly tell us a little bit more about what Gordon Brown is suggesting and how seriously that's being taken?
Gordon Brown, who actually played a role in trying to deal with the consequences of the financial crisis, the global financial crisis of 2008, 2009, has argued that basically representatives of most countries in the world, including developing countries, should form a temporary executive to try to come up with a coordinated response to COVID-19. You may recall that we've discussed New Zealand's response in the past, and New Zealand has done really well, not least because it has taken science seriously and the advice of public health professionals in this country, and it's also been very willing to learn from the experience of other countries like South Korea, Singapore. But however well New Zealand does, if we eradicate the problem here or suppress it dramatically, we still face the problem that there is not a coordinated response outside New Zealand to deal with it. Every state at the moment is competing for ventilators, they're competing for masks, they're competing, it's almost a race to the bottom, they're competing for things and they're trying to solve a global problem with a national interest approach. And I think what Brown is saying is that governments seriously have to accept this as a global emergency and that a global challenge like COVID-19 requires, by definition, a global response.
So how seriously is that call being taken by Gordon Brown, by the world leaders?
Well, it's only just come in the last few days. I think given the difficulties which many governments are now experiencing, when I say many, it's a wide variety of performance in relation to this problem. But countries like the United States and the United Kingdom, there's a lot of anger and frustration in both countries. And I think against that backdrop, I think his ideas might get more traction than they otherwise would. What is clear, as this problem escalates, and according to some health professionals, we're probably in global terms at the beginning of it rather than the end of it. Unless a vaccine is developed quickly, I think while there may not be an immediate uptake of Gordon Brown's ideas, we cannot rule out some sort of approach like this as the crisis deepens. And people, and we've already seen large numbers of people die, almost unspeakable numbers of deaths, are predicted. This is an extremely infectious disease, and we do actually need, there is a mismatch at the moment in the way that countries are being left to their own devices to deal with a problem that doesn't recognise borders. And I think what Brown is suggesting is that we need to be smart in the way we approach this problem if we're going to minimise its impact. And being smart involves coming up with much greater international coordination than we've seen hitherto to this problem. As it is now hitting the developing world, where there's a very poor health infrastructure, unless there's some coordinated international response, the impact of COVID-19 in those countries could be absolutely devastating beyond our worst nightmares. And then there is the danger that the longer this COVID-19 continues to spread, that it might mutate, which would again would complicate the severely complicate the prospect of getting a vaccine.
Right.
So yeah, I mean, I'm not sure Brown's idea, you know, how far it will go, but it's certainly, in the past, countries have, you know, shown a willingness after a disaster like the Second World War to internationally coordinate. They set up the United Nations, and right. The same after the First World War. In a sense, this, you know, many people have described the battle against COVID-19 as a war. It's certainly a very formidable foe.
Thank you, Robert.
Thank you.
And thank you for watching. Catch us next time on Global Insight. Ka kite anō.